I'm Dr. Jeff Zwerin, and in this video we'll discuss rhinoplasty surgery. Experience has shown that when asked what feature other than weight you would most like to change about your appearance, the usual answer is my nose. Maybe you inherited your uncle's nose with a hump in the middle and oversized nostrils. It's also possible that you might have taken a blow to the face and sustained a crooked nose from the injury. For others, it's a nose that's too wide, too big, or bulbous on the tip. As with all cosmetic procedures, you should look at nasal reshaping as an improvement and not perfection as a goal. During the planning phase, we'll strive for a nose that's in harmony with the rest of the face, both in size and proportion. We frequently use computer-generated images to guide us along in the planning process. From the computer images, we can determine which features you like and dislike, and together we will develop a plan so that you will reach your goal. We generally perform rhinoplasty surgery as an outpatient patient under general anesthesia. It's a procedure that we frequently perform in our accredited in-office surgery center. A rhinoplasty, even though it is one of the most challenging cosmetic procedures, is also very gratifying. The procedure requires an equal part of artistry and precision. We want to create a nose that is in balance with the rest of your facial profile while functionally sound. No skin is removed during the operation. It is the changes made to the cartilage and bone of the nose that will redrape to give the new nasal shape. For this reason, skin texture and elasticity play an important role in determining the final outcome. Those with thinner skin are likely to see the more subtle changes to the tip, while those with thicker skin tend to see slightly less improvement, especially on the tip. Next, I'm going to show an actual rhinoplasty surgery. The pictures are graphic and viewer discretion is advised. In the preoperative area, an IV will be started and you will meet with the anesthesiologist. You will be taken to the operating room and placed under general anesthesia. Next, you will be prepped and draped for the operation. The procedure is typically performed as an open rhinoplasty and begins with an incision at the base of the nose, with the remaining incisions inside of the nose. The only visible external scars will be in the small bridge of skin between the nostrils, called the columella. After the incisions are carefully made, the skin is gently separated from the underlying bone and cartilage. The two curved portions of cartilage that are visible just under the skin at the tip of the nose are the lower lateral cartilages. It is these structures that give the nasal tip its shape. These will be appropriately altered to give the new profile. The next step is in the operation exposure and examination of the nasal septum. This is the large rectangularly shaped piece of cartilage that divides the two nasal chambers from each other. If the septum is bent or deviated to one side, it is corrected by a series of maneuvers. The key to a straight nose is a straight septum. Several maneuvers are made to remove or straighten the deviated septum. If your nose has a dorsal hump, then it will be removed either using a small, rough file called a rasp or a small chisel or surgical drill. If the nose is too wide at the bridge, then this can be narrowed by weakening the bone with a small chisel-type instrument and pushing it together. Then, through a variety of maneuvers, the height, length, and width of the nose will be adjusted. This consists of trimming and reorientation of the cartilages using suture techniques. If the tip needs to be upturned, then the cartilage is usually trimmed or repositioned. Once all the trimming, suturing, and remodeling of the bone and cartilage has been done, the incisions will be closed. The sutures used inside of the nose are dissolvable. The only sutures that must be removed are those at the base of the nose. There is one last check for nasal symmetry and aesthetic result. Generally, a soft metal splint will be placed over the upper nose to keep the newly repositioned bone and cartilage in place, as well as helping the skin to adjust to the new underlying structure. The splint and any internal pack will be removed within 6 or 7 days following the operation. A certain amount of bruising is to be expected immediately following surgery. We will make every attempt to perform the operation in a gentle manner to reduce bruising as much as possible. Depending upon how you feel, you may be ready to return to regular activities in as little as 1 week or so. Full recovery will take some patience. The final appearance of the nose may not be apparent for as long as 1 year. When the splint is removed, you will see an immediate improvement in your profile. If any further questions, please visit our website at primacenter.com.